Well, the legacy of the Fred Hollows Foundation lives on through some extraordinary work being done in countries across Africa like Kenya, Burundi and Rwanda, where until its arrival there was no eye care at all. But of course, deep budget cuts to sub-Saharan Africa delivered in the May budget make the future of these programs far more precarious. The Foundation's medical advisor for Africa, Dr. Chiku Mathenge, joins us now this evening, and lovely to have you with us. Thanks for joining us. Give us a sense, firstly, in Rwanda, where you're from, what was there before the Hollows Foundation set up?
Before the foundation came, we were 4 doctors in the country. We are now 12 for 12 million. And the situation was such that sometimes a patient would come who needs cataract surgery, and I would have the skills to do the surgery, but I would have to send the patient to the city to buy gloves, to buy syringes, to buy injections for me to be able to do the work. Fred Hollows Foundation came in and put in systems that gave us the equipment, the consumables, and funded training so that more doctors were trained. And we now even have a center of excellence in Kigali where we can do the same surgery that you would have here.
That's remarkable. And how many people have you been able to help that you wouldn't have been able to help without that?
I would say that well, I stopped counting at 5,000, but I'm sure thousands of people have benefited from the input that Fred Hollows Foundation has put, not just directly as patients, but in the communities and the families of those patients whose blindness was reversed.
And this is because it's really avoidable blindness, people who are suffering with their eyesight where they don't need to.
Yes, the situation in Africa is that 80% of people who are blind don't need to be blind because they are diseases that could have been prevented or can be reversed, like cataract.
And continue to be able to be reversed?
They will continue as long as the supplies that are needed and the people who are needed to do the surgery are there.
So when you think about only 12 doctors, even though that is 3 times the amount that was there before, what impact could the funding cuts through the budget have on these kind of programs?
The type of programs that Fred Hollows has been implementing, some of them are benefit individuals. So when you do surgery on an individual, you impact that person and his family. But the more important ones are where Fred Hollows is training doctors, providing scholarships, building hospitals, and those are not things you can adjust suddenly. So when aid is cut, what do you do with someone who's in the 2nd year of training or a hospital that's half built?
So some of those budget cuts are actually funding training for those surgeons?
Yes, the type of aid that Fred Hollows provides is not the type of aid that brings about dependence. It's capacity building and putting in infrastructure, things that they can Fred Hollows can walk away and still leave them behind. So it's difficult when aid is cut suddenly because these are things that have been planned for the long term.
And what is the certainty? Do you know whether you will be affected or not?
I know that the Fred Hollows Foundation benefits a lot from the generosity of individual Australians, but I also know that for the large projects, the aid from the government is also very important. So I'm sure there will be a big effect, and I hope it's something that can be reversed.
Is it something that I guess, is it difficult for countries like Rwanda and Burundi, and we see the awful poverty in Burundi at the moment. I mean, do people connect this to another country that might be going, we've got different priorities, or do you feel that Australia should continue to make those sacrifices?
What happens in countries like Rwanda and Burundi is that the government has so many competing priorities and a limited budget. So things like HIV and malaria and maternal and child health, those are killer diseases. So much as government would like to support eye care, it's pretty low down on their priorities. And the gap is really filled by the generosity of countries like Australia.
Chiku Mathenge, we do appreciate your time, and thank you for the good work that you are doing in Africa.
Thank you, Beverly.